Hi everybody, welcome to the RHI Giving Day. Very, very excited about this day. We do this once a year and just extremely, extremely excited to be able to talk today and interview a very, very special guest who I'll introduce to you in a bit. But the RHI Giving Day is certainly supported by many, many individuals, all of you out there, certainly internal to the hospital and external, but I'd like to recognize a few of our sponsors today. Our miracle sponsors as well as our hourly sponsors. Our miracle sponsors are IU Health, Indiana University Health, as well as St. Vincent Ascension. And our hourly sponsor today for this hour is Anders CPAs and Advisors. So we want to express a huge, huge thank you. Very grateful for all of you committing to this RHI Giving Day. The Giving Day really revolves around a variety of things, but as it relates to this year, we're really looking at focusing our attention on the Spinal Injury Model Systems grant, and that is a huge, huge research initiative that we are looking at in terms of fundraising for here today. Also looking at continuing educating our therapists and our nurses around best practices, clinical pathways through what we call MedBridge, and certainly we continue to fundraise for our patients and turning back to our patients those things that they might need during the course of their therapy, and again, meeting their day-to-day needs as their inpatient hospital stay demands of them. So with that, I'd like to, I'm very excited about introducing Mr. Jerry Arthur. So I've known Jerry for a long time. He is a foundation board member. He is somebody who just exudes enthusiasm and passion for RHI and what we do. He's somebody who is very special to our organization and certainly to me. As I spoke with him a little bit earlier, he's kind of a model for me, a model for our organization, not only from a business standpoint because he is extremely well-versed, highly intellectual, but equally, he has a heart of gold and somebody who, when you put those two together, you create a hybrid and a person that's extremely unique. And I just can't say enough about him in terms of being blessed to know him and to be able to learn from him and kind of model, certainly work towards his modeling of all of us and trying to translate what I know he's so great at and I know I'd love to be great at. With that, I want to ask Jerry a few questions today about RHI, and I know you're so highly, highly committed to RHI, and I just wonder how that evolved over time. How did you get to that level of commitment?
Well, thank you. Thanks for the nice compliment. Call me a worn-out model, if you will. I really became interested in this hospital as a result of my son having a stroke, and that happened 8 years ago here. It didn't happen here, but he was brought here just barely out of a coma from the hospital, and the prognosis was not good at all. My son, it was fully expected that he would be bedridden forever, but RHI provided a recovery that was totally miraculous, and I attributed that to the skill and the commitment and the performance of three ladies that were therapists, the occupational therapist, the physical therapist, and the speech therapist that we had were absolutely remarkable, and each one of them within a 60-day period brought him back to an amazing place. And my bottom line thrill or being impressed was the last day he was here, he was put on a treadmill, and after 17 minutes the therapist asked him, "Eric, do you want to stop?" And his answer was, "I didn't know I had that option." And that just told me exactly what had happened inside this hospital in that 30 days, and it was a miraculous recovery and a miracle. And his stroke was a brainstem stroke that every neurologist told me the severity of his stroke, he his brain was locked. He could not get a signal out. He couldn't get a signal in. The brainstem controlled everything, and it was shut down, and proved not to be true. But when he sees a neurologist annually, he asks now, what can I expect? What can I do? What can I do? And he puts his own questions together, and the answer he always gets is, Eric, you're the only patient in this world. We don't know what to tell you. We don't know what in the world you can do. So that blew me away. What RHI achieved with him blew me away and made me very interested in the hospital. The other incidences here are overwhelming. I don't think anyone realizes how much, or at least most people don't realize, how much Indiana possesses with this hospital. It is a world-class hospital, and the research going on here is remarkable. It's off the chart. I came here one day and saw stroke victims, stroke patients, trying to run down the hallway and trying to go upstairs backwards. And the research physician in charge, and I'm like, what in the world? And he said to me, well, I'm doing this research. I feel if I can make the patient run, walking is easy for them. And that just thought, this is world class. This doesn't go on anywhere in the world. So those are the kinds of incidents, kind of things. I've had other friends that have had a stroke. I came here to visit them. Their result and their compliment and comments about the hospital is always the same. And I attribute that an awful lot to the leadership we have, which Dan, I think, is an extraordinary leader. A man that leads from behind and a servant leader that people love. And when people love their leadership and love their job, it's just nothing but morale in motion. It's self-esteem in motion, if you will. Maybe not morale in motion, but self-esteem in motion. So thank you.
Well, thank you. I mean, really appreciate those comments. And it's, as you mentioned, there's a variety of things going on here. You mentioned the therapists, you mentioned the world-class research, things of that sort. And sometimes we hear, you had mentioned too, I think earlier, that RHI is kind of the best kept secret in some cases. We still hear today, oftentimes if you haven't sustained a brain injury or a stroke or spinal cord injury or had a transplant, liver transplant or heart transplant, sometimes we're not aware of sort of things that are in our backyard, and that still happens to people out there. If you were to meet somebody coming here at RHI that never knew about RHI, what would you say to them? What would be a kind of a take home for them?
I probably, encountering someone coming in saying, I would tell them, just grasp what's being offered to you, what's being offered to your loved one, and grasp and embrace and help. One of the big compliments that we received early on was that the family was here all the time, spending time with our son and encouraging him and being with him, and loved ones around him. I've discovered since that time is an important factor. So you need, if you encounter the hospital and no one wants to for that reason, but if you do, you need to be there and support and help your loved one. The last thing I would say is, if you reach the point of donating to a charity and you're fortunate enough to be able to do that, I believe you should examine what's that charity really doing? What percent of your money goes to the charity and what percent goes to the administration? And here, 100% of money goes straight to helping the patients in the hospital grow. Other charities don't achieve that, and it's an important factor for a donation. So I would encourage donations for that reason, among others. But there's overwhelming evidence that says this is a good place to donate money to.
Well, we thank you, Jerry, so much for your comments. I think, as all of you see, Jerry is quite the comprehensive individual, right? He gives you a little bit of intellect, a little bit of research, a little bit of clinical aspects, and certainly a lot of heart, So we just thank you so much for taking the time to be here, all of your commitment to the organization. You are a huge blessing, again, on behalf of RHI, this entire hospital, and it just doesn't extend here from the hospital, right? You've made an impact from this hospital in terms of our community, and frankly, I'm going to say, yes, we have world-class research, but you're a world-class individual who's really helped to support that. So thank you so very much.
Thank you.
With that, I want to thank everybody for being a part of this hour. We're, again, very excited. As Jerry mentioned, this is a way to give back to our spinal cord injury research program, our patients, and looking towards the education of our nurses and therapists to ensure that we have best practice clinical practices, and we continue and sustain that and continue to grow, be a part of that world-class hospital that Jerry talked to. So I encourage all of you out there, please share our videos. We have them on the hour here, and you're going to take away something really special from each individual hour. Click on our link, and if you have it in your heart of hearts to donate, again, as Jerry pointed out, 100% goes back to our hospital, to our patients, and please invite others to be a part of this as well. We can't do this without you. As you can see, we certainly can't do it without the Jerrys of the world. So again, thank you for taking the time. Jerry, thank you so much for taking the time to be a part of this.
Thank you.